Hello, everyone. This is Noor, and thanks. This is the Thank Gut It's Fixed show. Thank you for joining me on today's episode, and that's episode number 18. And I'm going to be talking about the long-term effects of PPI use, which are proton pump inhibitors. I get this question a lot. I got it from one of my recent patients, and it just comes up in conversations a lot. So I really want to address it and talk about it. So before I start, let's keep this rule, as I always like to inform people and let you know that this is educational. This does not replace the seeing your doctor. If you are currently on a PPI medication, so PPI proton pump inhibitors, these are things like some brand names like Dexilant, Prevacid, Nexium, Prilosec, Protonix, Acifex. Some of the generic names, omeprazole, pantoprazole, so anything that has a ZOLE in the end. If you're already taking one of those medications, don't stop cold turkey. It will actually backfire, and for some people, they may be needed if you have like ulcers, or if you're on H. pylori treatment, or if you have Barrett's esophagus, where your esophagus is really has scarring from long-term acid reflux, or GERD. Does not mean that you will never ever be able to get off these medications, but you really need to work with your doctor. So take this as an educational and way to something to learn about these medications, potential long-term use, and some people on these medications, if you're on it for more than a year, then you're potentially at risk, and take this information to your doctor. What I really was hoping from this episode is, if you have some heartburn, acid reflux, or if you have even like things in your throat, so like difficulty swallowing, chewing problems, hoarseness in your voice, these are all related to acid reflux. If you're starting to see this to happen more frequently, and you're reaching out for Tums more often, or Maalox, or any of those medications, or if you felt like you can just go get that purple pill from the grocery or from the drugstore and it's okay, I want you to think twice about that, because these medications, once you get on them, it kind of becomes a long-term relationship, and you don't want to do that. So this, if anything, would love to encourage you to be, okay, if I'm having these symptoms, the heartburn, the acid reflux, what is going on with my body, with my gut, so I can fix this problem? How can I fix it with diet, lifestyle, and so that you don't have to get on a medication with potential many long-term side effects? Now, your doctor might tell you that they're fine, they're okay, and then you would have to make your own call, make your own decision. But nutrition, and where I work is I'm in the preventive. Before we get the prescription pad, if that's what you want for yourself, then I am make sure that you continue watching, and I hope this would be beneficial. So for those of you who just joined, this is Noor Zibda. I am a functional dietitian and nutritionist, and today's episode is about the long-term use of PPI medications and potential risks, and what things that you can do if you are with acid reflux, and if you have a medication, like things that you can do to potentially be able to slowly taper their use and not have to get on them. So, as I said, PPIs, when it comes to acid reflux medications or heartburn, so you have things like Tums, which just neutralize the acid. So if you feel acidic, acid and base, they neutralize each other, basic chemistry, and that's how they work. And then you have another class of medications. These are called H2 blockers. They're not as strong as PPI medications, and when PPI medications like Zantac is the H2 blockers, and when PPI got on the market and they were more effective, so doctors started using them more, and I believe it was 2003 is when they were allowed to get as an over-the-counter non-prescription medication, and that's where it becomes a problem. So there's $10 billion in 2012, the sales of anti-acid medications, or the PPI medications. So interesting thing, one report shows that half of the people on PPI medications don't actually need them, don't have a clear indication for them. And here's an interesting thing. A lot of times when people are prescribed a non-steroid anti-inflammatory NSAID, prescription or that recommendation comes with an antacid. So, for example, if you're, maybe you're taking aspirin to prevent, cardiovascular issues. Maybe that's like a different. I'm not talking about that. But let's just say you need to pop, Advil all the time because you're in pain or because you have an inflammatory condition that's making you have joint and muscle pain, and now your doctor says, well, take high dose of NSAIDs, and oh, by the way, take a dose of PPI. Then you really have to step back and see, like, is this what you really want for your health? A medication that corrects another medication, or is there something that you can do with the way you eat, how you eat, the foods, how you supplement? What can you do lifestyle-wise so that you can avoid both medications if possible? So I'm going to start with some of the risk factors or the things that we found about PPI medications. And if you're here joining me, just say hello, say hi. I know it's a very heavy medical topic, but I hope this is educational, and keep in mind it does not replace you seeing a physician who can help you with your care. This is just to raise some awareness on these types of medications. So PPI medications actually increase the risk of C. difficile or C. diff infections. So C. diff infections tend to cause, the symptom is diarrhea. And most people associate C. diff with antibiotic use. So if you've taken an antibiotic and after the antibiotic you end up with diarrhea, it's not necessarily you're going to have it, but it's one of the pathogens that can grow as a result of that. Now, one study found, and I'm just reading here from my notes, one study found that 27.7, so 27.7 participants in a study that actually they found the association between C. difficile and PPI use. And those people did not even have antibiotic use. So, and another study found that PPI use increased the risk of C. diff by 1.7 times. So that's, a lot of the medical community had made big strides in reducing antibiotic use when it's not recommended. Like, doctors are not as much prescribing an antibiotic every time you feel sick or if you complain of your throat or your stomach ache. But the PPI medications are on the counter. Like, you can just go and get it, pay a few dollars, and pop that pill. So that's where they become really dangerous, because somebody who maybe is not willing to explore why the body is, the symptoms happening, and they would rather get a quick fix or just pop a pill, then there's so much misuse and abuse of these medications. Another infection is actually Camelobacter infection, which is another type of bacteria, 3.7 times more infection when people were taking PPI. Now, why does that happen? Because PPIs reduce the acidity of the stomach. And we know the stomach, we're naturally made to have stomach acid, and stomach acid is going to keep the pathogens from growing. It's going to keep a sterile condition in the stomach and in the small intestine. So now when you're taking PPIs, and especially long-term use, then we're finding that the infections, your gut is more likely to develop infections. Okay, so that's the first one. Now, along the same lines, hi Tanya, thanks for joining. Now, along the same lines of infections, and Kathy, thank you for joining me as well. Oh, cool, from Jordan, hi. Okay, so the other one is PPI-associated pneumonia. So you might think, wait, what is the respiratory system, which involves your chest and your lungs, what does that have to do with the PPI in the stomach? Now, the respiratory system and your digestive system, I mean, you're breathing and you're eating, we share the trachea, we share, think of it, we share the tubes, or both systems share the same tubes. So when you have pathogens in the stomach, and in the duodenum, which is the first part of the small intestine, and you have reflux, which is why most people take those medications. Actually, the stomach content can splash up to the esophagus and can aspirate or go to the lungs and to respiratory system. So for people who are immune compromised, elderly, people who take antibiotics frequently, people who get sick frequently, you are at risk of pneumonia if you take PPIs very frequently. And I have one report here, 50% increase of pneumonia in people with PPI. Now, another studies have shown that even healthy people who are not in the hospital, a lot of times people just associate pneumonia with hospitals, also found an increase in PPI with increase in pneumonia with PPI, and that's along the same lines of when my recent book, The Complete Acid Reflux Diet Plan, we talk about LPR and which is related to your throat, and most people don't connect that the difficulty swallowing or a lump feeling in their throat is related to acid reflux, or they don't think that, some studies link that acid reflux can cause asthma and pneumonia. So what goes in the stomach and in the duodenum and in the small intestine is actually can reflux and aspirate in the lung and cause pneumonia as well. So these both systems are connected. Hi Bob, thank you for joining. So the third thing, so two types of infections first, and if you're just joining me now, just keep in mind that this does not replace your working with a medical provider. The point of this video is educational. If you're already on a PPI medication, don't just stop, because actually it's going to cause backfire, and it will have more damage than taking them. So you really want to work with your doctor to taper their use if you decide to do that. Now the third thing is that they're going to interfere with mineral absorption. So 14 days on omeprazole therapy, which is a PPI, caused 41 reduction of calcium absorption. And calcium is an important mineral for the bones, for muscle contraction. It has so many functions in the body. And another mineral that may be at risk is magnesium. And I believe in I talked about magnesium in episode 9, so you can go back and look at that and watch that as well. So what they found in severe cases of magnesium, they found that there's an increased risk of heart attacks. And some of the symptoms of severe magnesium deficiency can be cramps, muscle weakness, convulsions, arrhythmia, and hypotension, which is low blood pressure. So it's even if you don't have those severe symptoms, I talked about magnesium, that it can cause headaches, constipation, muscle pain, muscle cramping. And so if you're not absorbing this mineral due to the PPI, then that may be a problem. So, and then, because the PPI, what they do is going to reduce stomach acidity, and you really need that acidic environment for your body to absorb not just magnesium, iron, selenium, zinc, and calcium as well. So people with thyroid problems, selenium and zinc are going to be really important for T4 to T3 activation. Zinc is going to be important for your hair. Selenium is an important antioxidant. Magnesium is needed for many types of pathways and enzymatic reactions in the body. Iron, of course, it's important for delivering oxygen to your cells. So when you create a long-term non-acidic environment where you are potentially at risk for nutrients and minerals not being absorbed, then that can create a problem. Another nutrient that can be a problem is B12. So B12, you need to have enough acidity in the stomach, so B12 can be broken down to get uncoupled from the proteins that it comes attached with in food, like in red meats, for example. So then it binds to another protein so that you can absorb it in the large intestine, in the small intestine. So long-term use of PPIs has been also associated with vitamin B12 deficiency. Again, you know, you may be feeling tired or fatigued. That's one of the symptoms, but severe B12 symptoms can, severe B12 deficiency symptoms can mimic something like MS or multiple sclerosis. So you've got a range from like feeling nerve pain or neuropathy or tingling in the hands and feet to and fatigue to something that could be potentially mistaken for something you know, that could be solved with just fixing nutrient deficiencies. I think that may be getting a little bit more complicated. I hope you guys are following me here. If you're still here watching, just say, you know, give me a thumbs up or a like or something, just to make sure we're good to go. So we talked about nutrient deficiencies. I want to go back to calcium in here because actually some long-term use of PPIs for more than a year, so that's what's considered long-term use, has been increased the risk of osteoporosis related fractures in the hip, wrist, or spine. So actually when they did the studies, I can't remember what the study it was. I think they were looking at the use of PPI for one thing, and they discovered that actually people who were taking the PPI were more likely to have a fracture. And so 5 years is going to even cause an excess risk for fracture. So the longer you use PPIs, the more at risk you will become. Now, part of it is because of the calcium absorption, obviously, but there may be other stuff as well too. And if I don't know if I talked about this before, but your gut is going to produce vitamin K2, which is going to help your body take the calcium and put it on your bones. And PPIs are going to affect your gut microbiota because they're going to affect the acidity is going to maybe promote the growth of certain bacteria over others, and that could be one way that they find that by altering the microbes in the gut, the PPIs can cause osteoporosis related fractures. So we're going to talk about all of these. Okay, next one is SIBO. So I talked about SIBO in episode 16, so that's 2 episodes ago. So SIBO is small intestinal bacterial overgrowth. So that's a condition that's been getting a lot of publicity lately. And what SIBO is that you have bacteria that is growing upper in the small intestine, and this bacteria is going to ferment carbohydrates and sugars, and it's going to produce gases, and these gases are going to cause stomach pain, changes in your stool form and structure, maybe diarrhea, maybe constipation, maybe alternating, and many healthcare providers, and I'm one of those who believe that SIBO can be a root cause of acid reflux. So let's just say you have a lot of bubbles, 3 gallons of filled of gas in your stomach, and these are going to push the content of the stomach upward, and that's going to cause acid reflux. So you're it's kind of like a cycle. PPI use is going to increase the risk for SIBO because you don't have the stomach sterile acid environment to protect or prevent bacteria from growing. So the higher the pH, the less acidity, and then bacteria is just going to love that space, and they're going to grow farther. And so SIBO can cause acid reflux, and taking a PPI to treat acid reflux can make SIBO worse or trigger SIBO. So it's you're playing catch up, and like one is causing the other. So it's really important to look at things, address things from a holistic perspective. One thing you can see if you have SIBO is take out carbohydrates. Take all carbohydrates and all starches, and if you feel like your acid reflux and the bloating is improving, that's not like a diagnostic test, but that may tell you that you actually have SIBO, and especially if you're on PPI, maybe that's contributing to it. PPIs increase the risk of stroke, maybe related to magnesium, but also PPIs reduce nitric oxide, which is important for your blood vessels to dilate, which means that there's enough blood flow going through your veins to your brain. So that's another one that may be a problem from long-term use of PPIs. And liver health, I found there's some evidence that people on PPI medications actually may have an overgrowth, an increase in enterococcus type of bacteria. And what this bacteria is, they found that people with PPIs, can this bacteria migrate to the liver and cause liver damage? And people on PPIs are more likely to have fatty liver. And fatty liver is a condition where there is more fats in your liver, and that's going to affect your liver's ability to detox pathogens and chemicals and toxins and medications and everything that you're putting into your body. And fatty liver can happen from alcohol use, but it happens from non-alcohol use. There's a condition called non-alcohol fatty liver. Eating sugar is one of those reasons, but now they also found PPIs to be related to those. So we talked about, a lot of things. I kind of want to summarize this. And if you're just joining me late, keep in mind that this does not replace seeing a physician. The purpose of this, I want to share the side effects so that if you were thinking, or if you're one of those people who pop a Nexium pill over the counter and you think it's okay, it actually may not be okay. And there is a danger, and half of the people who are taking those medications don't actually need them. So they can increase C. diff or C. difficile infection, which, typically the symptom is diarrhea. They can increase the risk for pneumonia, increase the risk for SIBO, small intestinal bacterial overgrowth, which can cause bloating, stomach pain, heartburn, diarrhea, or constipation. They increase mineral and nutrient deficiencies like calcium, magnesium, selenium, zinc, and vitamin B12, increase the risk for fractures, increase the risk for strokes. So there are definitely, I think that was all it, and iron deficiency as well. So so here's the thing. What are you going to do about this information? If you have some heartburn and acid reflux and you don't take a medication, knowing this, if anything, I hope this makes you think twice before you decide to go and think that a pill is an easy solution, a magical solution. It's not a magical solution as well, and you may hurt your body than help your body. So that's number one. Number two, if you are on a PPI medication, it's very, very important to talk with your doctor. If you cut it out completely cold turkey, what would happen is that there's a rebound acidity, is that cells in your stomach, they will overproduce acid, and that would cause your symptoms worse, and that can cause atrophy or damage to the cells of the stomach. So you really need to slow down your dose, and then you want to work with your doctor to find the best plan for you. Now, whether you want to taper the medication or you want to prevent or needing to be on a medication, there are two things that you can do: diet and lifestyle. So one thing is that you want to follow a diet that is going to help with acid reflux. So eliminating the foods that can cause acidity, like coffee, tea, citrus, tomato, caffeinated beverages, garlic, onion, and a whole list of foods that actually increase fermentation. So if you're one of those people, I highly, highly recommend that you check out my new book, The Complete Acid Reflux Diet Plan, and I will put the link in the comments or in the description. So it's a very simple book, and you really don't have to give up a lot of your foods, and it's not a long-term necessarily plan, because we're trying to help your the stomach and the esophagus heal and give it some time to rest, and then you get to introduce more foods later on. So with diet, you can cut the dose in half, with the medication dose in half. It is very possible. So the book, I've been talking about acids, or like a diet for low acidity and diet for, and it's not just the acidity, it's also fermentation. And since I believe that SIBO can be, or maybe one of the very major contributors to acid reflux, I've also addressed a SIBO friendly. The diet is also going to help you if you suspect that you have SIBO. So we're hitting two birds in one stone with this. So that's number one. Now, lifestyle or supplement wise, some of the things that you can incorporate naturally, things like aloe vera. So you can add, there are supplements in aloe vera that are really helpful, or you can get the aloe vera plant and incorporate that in your smoothies. And I'm planning to, post a video on that coming up sometime soon. There is DGL, which is a type of licorice that is going to also be healing to the stomach. Bone broth. So bone broth is going to provide you for glutamine and glycine. These are amino acids that are going to help heal the lining of the stomach, and it just also feels good. I do use glutamine in supplement form as well, but you can get it from food. Think of ginger. It's one food. It may give you a slight burn, but it's going to promote digestion so the food doesn't sit in your stomach, and helps with reduce the need to pop that PPI medication. So these are some of the lifestyle things that you can do. Obviously, not overeating, don't sleep after you, don't lay down after you have you eat and don't eat a big meal, don't eat big fried sugary foods. So this was some quick take home things to do. Let me make sure I did not miss anything in my notes. So take this information, try to see how that relates to your own health conditions. I definitely will have a complete write-up on my blog. So if you're watching this later on Facebook, make sure you come to my website. And if you want the written information to take to share with your doctor or to do a little bit more research, but if any, you can reduce acid reflux and you can take care of your heartburn and reduce the pain and reduce the discomfort without the need to get on medications like PPIs. They're not a magic solution, so they're not a magic pill. So you really have to work with your doctor to see, is the risk, does the benefit outweigh the risk? Do you really, really need them? Can you only take them for a short period of time as opposed to long-term use? And then if you do take them for a short period of time, what can you do to support the gut to go back to its normal function so that you're not at risk for any overgrowth of bacteria or nutrient deficiencies? So that was today's episode of Thank Gut It's Fixed, the potential side effects of long-term use of PPI. I know it was a pretty maybe dense medical talk, but I hope this was helpful. Join me next week and on the same show. And if you found this useful, share with a friend, share with someone who might benefit, or tag them in here and comment. And if you have any questions, I'll be around and I will make sure I come back and answer them. All right, see you later. Bye.